Hello, good morning. My name is Athleen, and I am an MSOT student at Kaiser University. And today I will be talking about the occupational therapy process for a 21-year-old female with depression who was referred for occupational therapy services 2 times per week to address a decrease in social interaction skills, or work performance, and her ability to get to work on time. During this process, two occupational therapy strengths that were identified consisted of the individual's ability to engage in ADLs, such as her bathing, dressing, and grooming. And second, a second strength that was identified was her ability to actually get up and go into work, and her ability to participate in simple meal preparation. Two weakness that was identified during this process consisted of her impaired social interaction skills with her peers and a decrease in her work performance. Three characteristics of depression consist of, again, a decrease in social interaction skills, as the person tends to want to be alone and away from others, a decrease in appetite, and difficulty concentrating on a desired task. The frame of reference that I would use to guide my intervention for this individual would consist of the cognitive behavioral frame of reference, because it assesses how an individual's feelings, moods impacts their behaviors. Again, we're looking at how the individual's feelings and their moods impacts their behaviors. Once these feelings are identified, the intervention would focus on helping the client refrain from the negative thoughts or emotions to improve their overall performance within their daily activities. A second frame of reference that I would use would be the behavioral frame of reference. Now, despite its similarities to the cognitive behavioral frame of reference, this frame of reference does not only identify the problems, but also seeks to identify the underlying factor that is actually causing the problem. What exactly it is. Is it a psychosocial issue? Is it something within the environment that's resulting in depression? So the behavioral frame of reference seeks to identify the underlying factor. It also focuses on developing strategies that will decrease the behavior and again improve the individual's ability to participate in this case, her work performance and her social interaction skills. The assessments I would choose for this individual is the Canadian Occupation Performance Measure, which is a top-down approach and a self-assessment that measure the perception of the client in the area of leisure, productivity, and self-care. I would also do a manual muscle testing assessment, which is a bottom-up approach to address strength and endurance needed to carry out those daily activities and to also improve mood, concentration, which are characteristics of depression. Two occupational therapy based outcomes that I expect to derive from these interventions are increased social interaction skills with peers and improved work performance through decreased tardiness. Two COAST goals for this client would consist of: one, the client will improve her work performance by getting into work on time through use of sensory cues from alarm clock and document progress with an improvement noted in a reduction in tardiness of 2 out of 30 days in 1 month. The second goal is The client will improve her social interaction skills by going out with her peers 2 times per week through use of visual cues posted at home for reminders and through journaling in 1 month. Thank you.